Some pills you take every day could be silently stealing your memory. Not in months, not in years. Sometimes the damage begins the moment you swallow them. As a brain specialist, I can tell you what we call normal aging is often something else entirely, side effects hiding in plain sight. Millions of people over 50 take these medications for pain, sleep, allergies, or anxiety, without the slightest idea that they might be reshaping their brain. And the most disturbing part, many of these drugs are approved, common, and trusted. They sit quietly in medicine cabinets all over the world. Doctors rarely warn patients about the potential long-term effects on memory and cognition. They focus on immediate relief, not the slow erosion happening in the background. That's why so many people assume their forgetfulness is just getting older when it might be something far more preventable. The truth is, there are entire categories of medications that science has linked to confusion, memory loss, and even dementia. Pills that seem harmless because they come in a familiar package or were prescribed by a trusted doctor may quietly be rewriting your brain's future. In this video, we'll uncover the hidden risks behind these everyday medications. You'll learn which pills to look out for, why they harm the brain, and how to protect yourself and your loved ones. The goal isn't to scare you, it's to empower you with knowledge that could change the course of your life. Before we begin, make sure you subscribe to this channel and turn on notifications. We share life-saving insights like this every week, and staying informed could be the single most important thing you do for your brain health today. Some pills that millions of people take every single day may, little by little, erase their memories. It sounds alarming, and it should. Medications we assume are harmless can, over time, leave lasting marks on the brain. People over 50, in particular, often take these drugs for years without ever being told what might be happening in the background. Doctors prescribe them for pain, sleep, allergies, even mild anxiety. They seem routine, almost part of everyday life. But quietly, some of these pills interfere with the brain's delicate balance, creating a slow, creeping fog. What starts as occasional forgetfulness can progress into something far more serious. The frightening truth is that memory loss doesn't always come from age alone. Research shows that many cases of confusion, brain fog, and even dementia are tied to medications that were supposed to help. Yet the conversation rarely happens in the doctor's office. Patients just keep refilling prescriptions. Millions around the world are unknowingly taking medications that research has linked to memory problems and dementia. These aren't exotic or rare substances. They are pills you might see on a nightstand, in a bathroom cabinet, or even in your own home. And the connection to memory decline is stronger than most people realize. What makes this issue even more concerning is the silence around it. Many doctors hesitate to discuss these risks unless a patient asks directly. And patients, they usually don't ask. After all, who would imagine that a pill for sleep or allergies could quietly change how their brain works? Today, we are breaking that silence. You'll discover which common medications are linked to memory loss and why they have such a profound impact on the brain. And once you see the evidence, you may find yourself questioning not just one pill, but the entire idea of what's really safe for your mind. Anticholinergics are a class of drugs many people have never heard of, yet they are among the most widely used medications for people over 50. They block a key neurotransmitter in the brain called acetylcholine, which is essential for learning and memory. Without enough of it, mental sharpness begins to fade, subtly at first, then more noticeably over time. Studies have shown something alarming. Long-term use of anticholinergic drugs can increase the risk of dementia by up to 50%. That's not a minor side effect. That's a life-altering consequence. And the problem isn't just one pill. It's that these drugs are prescribed for so many different conditions. You'll find anticholinergics hidden in medications for bladder control, allergies, motion sickness, and even some older antidepressants. They don't come with bold warning labels saying this could harm your memory. Instead, the damage is quiet, cumulative, and often dismissed as simple aging. Imagine someone taking a pill for an overactive bladder for years, thinking it's harmless, only to notice that they are struggling to recall names, appointments, or conversations. Families see the changes too, but they rarely connect it to the medication. The link between these pills and memory loss is often missed until much later. Doctors are beginning to raise awareness, but the message hasn't reached most patients. Some professionals now review all prescriptions for older adults, looking for anticholinergics to replace or reduce, but that's not standard everywhere. Too many people remain in the dark. Knowing the name anticholinergic might just change the way you look at your medicine cabinet, because once you understand how they work and the price your brain might pay, it becomes impossible to ignore the question, is this pill really worth the risk? Benzodiazepines are among the most commonly prescribed medications for anxiety and insomnia. Names like diazepam, alprazolam, and clonazepam might sound familiar. They've been in households for decades. These drugs promise relief, helping people relax or sleep. But behind that calm exterior, there's a hidden price that few consider. When taken regularly, benzodiazepines can dull the brain's ability to process and store new information. What starts as mild drowsiness or forgetfulness can evolve into confusion, disorientation, and even long-term memory loss. The very medication meant to soothe the mind can, over time, cloud it. Doctors often prescribe these pills for short-term use, weeks, not years. But many patients continue taking them for months or even decades. Each pill adds a layer of dependence, making it harder to stop. Meanwhile, the brain's natural clarity fades, replaced by a haze that few connect to their nightly help for sleep. Some studies have linked chronic benzodiazepine use to an increased risk of dementia, especially in older adults. This is not a minor concern. These drugs alter brain chemistry, and the effects don't simply disappear when the pill wears off. For some, the damage can be lasting. What makes this so dangerous is the illusion of safety. Because benzodiazepines are prescribed by trusted doctors, people assume they are harmless if taken as directed. But that assumption ignores how powerful these drugs truly are and how easily they can rewrite the brain's functions. If you take a benzodiazepine every night to fall asleep, it might feel like a lifeline. But the question no one likes to ask is, what is it doing to your memory, your focus, and your future? The calm they bring now may come at the cost of the very thing you most want to protect, your mind. Antidepressants have been life-changing for millions, offering relief from deep sadness, anxiety, and sleepless nights. But not all antidepressants work the same way, and not all are equally safe for the brain, especially in people over 50. Some of the oldest types, called tricyclic antidepressants, carry risks that are rarely discussed openly. Tricyclics, like amitriptyline, have a strong anticholinergic effect. Remember acetylcholine, the brain's memory messenger? These drugs block it, leading to confusion, foggy thinking, and memory lapses, especially when used long-term. What starts as, "I forgot where I put my keys," can, over time, turn into something much more serious. Even newer antidepressants, like SSRIs, aren't entirely free of concern. For people who already have cognitive decline or early dementia, these medications can sometimes make symptoms worse. It's not about stopping them outright. It's about knowing the potential risks and weighing them carefully with your doctor. One of the challenges is that antidepressants are often prescribed for years, even decades. Patients start them for a period of stress, insomnia, or pain, and then never stop. Over time, the brain adapts, and the subtle side effects accumulate, becoming harder to separate from just getting older. Many people assume that if an antidepressant is helping their mood, it can't be harming their memory. But the brain isn't divided into separate compartments for feelings and thinking. The same chemicals that lift your spirits may also be quietly clouding your thoughts. So here's the question every patient should ask. Is this antidepressant supporting my health, or is it quietly eroding the sharpness of my mind? The answer depends on awareness, regular reviews with your doctor, and the courage to explore safer alternatives when necessary. Corticosteroids are powerful medications used to treat inflammation from conditions like arthritis, allergies, asthma, and autoimmune diseases. For many, they feel like a miracle, reducing pain, calming rashes, and easing breathing. But these benefits come with a heavy warning: long-term steroid use can deeply affect the brain. Prolonged use of corticosteroids has been linked to mood swings, confusion, and even memory loss. Patients often describe feeling foggy or not themselves, unsure if it's the illness, the aging process, or the pills themselves. In many cases, the culprit is right there on the prescription label. The brain reacts strongly to steroids because they mimic stress hormones. Over time, these hormones disrupt normal brain function, affecting how memories are stored and recalled. The result: a creeping decline in mental clarity, sometimes mistaken for depression or even early dementia. One of the most troubling aspects is that corticosteroids are often prescribed for extended periods. A treatment meant to control inflammation can slowly and silently create a different kind of damage, one that's harder to see until it's already advanced. Patients report more than just memory lapses. They notice irritability, trouble sleeping, and a sense of disconnection. Families sometimes see personality changes they can't explain, unaware that the very pills meant to heal the body may be quietly altering the mind. If you, or someone you love, takes corticosteroids regularly, it's essential to ask the right questions. Is there a safer dose? A shorter course? An alternative treatment? Because while these drugs can save lives, they can also steal something priceless if used without careful oversight: the clarity of your own thoughts. Antihistamines are in almost every household, often seen as harmless helpers for allergies, colds, or even a night of better sleep. But what many don't realize is that some of these pills don't just calm sneezing, they can quietly switch off key brain functions. For older adults, that can mean more than drowsiness. It can mean memory loss. The biggest culprit is diphenhydramine, found in popular products like Benadryl. It's sold as an allergy remedy, but it's also in many PM sleep aids. What seems like an innocent solution for a restless night can, over time, dull alertness and create a mental haze that's hard to shake. Antihistamines with strong sedative effects are especially risky for those over 50. They slow reaction times, increase confusion, and contribute to a feeling of disconnection from reality. For someone already struggling with memory, that extra fog can push them further away from mental clarity. The problem is that these pills are over-the-counter, easy to buy, easy to overuse. No prescription, no warning from a doctor, just a quiet slide into reliance. And because the side effects feel mild at first, people keep taking them, unaware of the cognitive toll. For caregivers and families, it's heartbreaking to watch a loved one fade mentally and not realize a harmless allergy pill is part of the problem. These drugs don't carry dramatic warning labels, but they carry a weight on the brain that builds over months and years. Before reaching for that nighttime pill again, it's worth asking, is this a quick fix or a long-term risk? Because in the search for a little relief from allergies or insomnia, too many people are unknowingly trading in their most precious asset, their memory. For many people over 50, taking 1 or 2 pills a day slowly becomes 5, 6, or even 10. Each prescription may have a purpose, one for blood pressure, another for pain, one to help sleep, but together they create a hidden storm in the brain. This overload of medications has a name: polypharmacy. When multiple drugs interact, the brain often suffers first. Confusion, drowsiness, and memory lapses become common, yet they are brushed off as just getting older. In reality, the combination of pills can blur thinking, slow reactions, and in some cases, raise the risk of dementia. The danger isn't always a single bad drug, it's the mix. A harmless allergy pill combined with a sleep aid, or a painkiller paired with an anxiety med, can push the brain into a foggy state that feels impossible to escape. And because each pill is seen as necessary, few notice the bigger picture. Doctors sometimes call it the prescription cascade. One drug causes side effects, so another pill is added to fix those effects. Then another pill is added to handle the new side effects from the second medication. Soon, the original issue is buried under a mountain of prescriptions. Older adults are especially vulnerable. Their bodies process drugs more slowly, meaning doses linger longer and interact more intensely. What feels like a normal medication routine may actually be an ongoing assault on mental clarity and memory. This raises a critical question. Is it really the illness causing confusion, or the cocktail of pills meant to treat it? The answer isn't always simple, but awareness is the first step to reclaiming control and protecting the mind from unnecessary harm. After hearing all this, one thing must be clear: knowledge is power, but action must be careful. The first and most important rule: never stop any medication on your own. Some of these drugs can cause serious withdrawal effects if suddenly discontinued, and stopping abruptly may be dangerous for your health. Instead, the key is to start a conversation with your doctor. Ask openly, are there safer alternatives? Is my current dose necessary? Could we reduce it? Many people are surprised to learn that small adjustments, a lower dose, a shorter treatment period, or even a switch to a gentler medication, can protect memory without losing the treatment's benefits. Bring a full list of everything you take, including over-the-counter pills and supplements. Often, the doctor sees only the prescriptions they wrote, missing the extra pills you picked up at the pharmacy. That complete picture can reveal hidden interactions or unnecessary overlaps that might be clouding your mind. If you're a caregiver, take the same approach for your loved one. Review every pill together with their healthcare provider. Sometimes, a medication added years ago is still being taken simply because no one questioned it, yet its side effects are quietly stealing mental clarity. There's hope in this process. Many people see remarkable improvements in memory, alertness, and mood after adjusting their medication plan. It's not magic. It's simply removing the unnecessary burdens the brain was carrying, allowing it to work as it should. So here's the takeaway: be proactive, be informed, and be bold enough to ask the right questions. Your doctor can be a powerful ally in protecting your memory and your future, but only if you bring this issue into the light and demand the clarity you deserve. Join our channel's Members Club today to stay ahead with exclusive insights, early access to videos, and content that will help you protect your health and your memory for years to come. Being part of this community means you'll always have the latest information to share with your doctor and to safeguard the people you love. Now that you've seen the truth, there's no way to unsee it. The pills sitting in medicine cabinets, the ones taken every night for sleep or every morning for pain, might be doing far more than anyone warned you about. But awareness isn't meant to create fear, it's meant to create change. The next step is clear. Don't panic, don't stop medications abruptly, but do start asking questions. Show this video to your doctor, your family, anyone who needs to understand what's really at stake. Conversations like this can save memories, independence, and even lives. Imagine waking up 6 months from now sharper, clearer, and more alert, simply because you reviewed your medications and made changes with your doctor's guidance. That's the reward of taking action. Your brain isn't beyond help. In many cases, it can recover when the weight of unnecessary drugs is lifted. The question is, will you do something about it today, or wait until the damage goes too far? Your memory, your clarity, your future, they are all worth fighting for. And if this video opened your eyes, subscribe now, share it with someone you care about, and stay with us. The journey to protecting your brain has just begun, and together we can make sure no one loses their most precious asset, their mind, to a pill they never questioned.